probably feel as a treatment is over, but it's not really over because it's always a confusion of what's next. But some of our viewers or listeners may be thinking and wondering why a cancer survivor would have, some mental issues after they've defeated cancer. Can you explain that a little bit? Sure. It's really one of the points I wanted to share the most today is that many patients, when they finish their treatment that's one of the hardest times for them. Because at that point they start to worry about the cancer coming back. They can often also have a lot of other symptoms even when their treatment is finished. So they may still have teeth pain, sleep problems, emotional issues that come up afterwards. But it's hard for their family and friends to understand why they're not happy. Why they're not just really the cancer is gone, so it really is a difficult time. So you mentioned some of the symptoms and you such a teeth sleep issues. Can we go a little bit about sure there's a lot of physical symptoms patients may still have after they finish their treatment of cognitive changes and he's concentrating. And with their memory, they can have a lot of insomnia is very common, but I don't look during cancer treatment and then there can be emotional anxiety, depressed mood, irritability difficulty with functioning at work and home. All of these things can happen now. These to clarify, these symptoms are happening during treatment is all after cheats as well, starting during treatment, and then can't gamble. I feel really tired, low energy and you may not feel like you can do any activity. And then you may be down for a day or two that you feel guilty, and when you're feeling better, what tends to happen is she's really try to pack all their activity until one day becomes a cycle. So one of the skills we teach patients, how to pace themselves, how to plan a reasonable amount of activity for them at the point where at now and their recovery, and then also to play on pleasurable things to help get their mood up and then also breast cancer treatments, being a survivor. How does a patient hope? It can be really difficult to cope. So, probably the first thing that happens when they finish their drug very common on breast cancer. Patients up to 70% of patients may have this really strong fear that the cancer is going to return. They can really remind themselves of all the things they've done. So all the treatments they've completed, whether it's surgery, chemotherapy, radiation, the medications they might still be taking to help prevent the cancer from coming back, but even knowing that there's that small percentage can keep that you're there. So it's really important to share that with other people too, talk about it, not avoid that fear. So talking to your family about it can help. Talking to someone like me could help, and really thinking about how that they would cope with it. If it did come back, even if there's a small chance, many times that fear is something that needs to be faced. Now that was one of my questions, I'm going to ask it now. How do you recommend patients communicate this invisible and anxiety that they may have with friends and family? Is it something that you would think like to do in counseling, to do just a big group one-on-one? Depends on the patient. It really depends, but certainly it's something you can do with the people that you're close with as well. Just sit down and let them know how you're feeling. We talked about using words to name your emotions, really asking your family to listen and not try to fix it. Because that's the tendency, is to want to make you feel better, but sometimes people just really need to. So, if they can name those emotions, share what their fears are, and their family can listen to those and just either for them sometimes. That's really effective in helping. That's very helpful. Now, is there something like meditation or anything kind of mindfulness that you recommend? Yeah, so I trained a lot of patients and different relaxation weeks. So we trained them in things like deep breathing, progressive muscle relaxation, and guided imagery. Actually those can be accessed on our website by any patients, just Cleveland Clinic that work. That's much breast cancer relaxation. Help us get some exercise. There's a little bit about that as well, but certainly for survivors, we know that exercise and keeping your weight normal can really help reduce your risk of recurrence. So that's something in our control. That we can add to our daily lifestyle. The recommendations are really high. So, 50 minutes of exercise a week into 2 units of weight training. So for many survivors, that sounds pretty overwhelming. So we really encourage them to make SMART goals. Those are goals that are specific, measurable, achievable. So if you're not exercising at all now, you might say, okay, I want to exercise for 10 minutes 3 times next week and just start achieving those goals. You can build your confidence to work up to that, 50 minutes late, right? And one of the things that you've mentioned, fatigue, imagine diet can help somewhat with that. Sure. I mean you need energy to be able to do activity. So, definitely eating regular meals is recommended. There's different dietary recommendations in terms of, eating whole grains, fruits and vegetables. Women eat red meat, those types of things, but it's basically, eating a well-balanced diet and eating regularly through the day. Great. Now, I want to ask you, with patients that have history of anxiety or depression, that everybody wants to share it. Not everybody wants to talk about it, especially if it's depression. And, little bit of stuck denial that you want to talk about it again, or whatever it is. How can you tell if someone is? How could you tell if someone is acting different after achievement of sure? People change after a cancer diagnosis. How do you tell what? It's normal. It's normal. She just went through a hard time. Versus like, we should reach out for her. Yeah, so often with anxiety disorders, there's withdrawal and avoidance of whatever the feared thing is. So with breast cancer survivor, you might see your loved one withdrawing from talking about it. They don't want to talk about it. They avoid it. They don't want to maybe, be seen with other clothes, because of their reconstruction or their breast cancer surgery. So, all we need is one of those signs that you'd be looking for, I think in terms of when, as a family member, that there's an issue. It's really looking at, are they changed in a way where they're not functioning? Well, where they're not going to work, where they're not able to go to family functions and enjoy themselves. Those would be some signs to look for. I think it's important to point out that cancer patients are higher risk for suicide. So looking for those kinds of warning signs as well, Kathy and Wharton. But one of the most important things is to recognize that breast cancer can be traumatic for patients. So some patients with breast cancer develop actually post-traumatic stress disorder. So just like someone going through another type of trauma, they may develop this intense fear of the breast cancer journey or fears about the treatments that they've been through. So, in those situations, withdraw socially again. Like we talked about the me, I'm Leslie problem. And triggers come out. So, as much as it's wonderful Breast Cancer Awareness Month and raising awareness for women to get mammograms and to talk about breast cancer, it's actually a really difficult month for a lot of survivors because there's so many stories about breast cancer that they're seeing that it triggers some of the PTSD reaction. That's very good to know. Go back to one of the questions that we actually just had, but we were having some fun. To reach for help. Okay, so some of the science you might want to look forward. If you are not enjoying things that you normally enjoy or withdrawing from activities, you're having sleep problems, crying frequently. Certainly any thoughts about hurting yourself. Or sometimes this comes out in breast cancer survivors is just preoccupation with death. If I wasn't here, those are warning signs that you would really want to talk to a mental health professional. Now, I know you mentioned physical changes, that's something that I'm sure a big one. Whether it's hair, just whatever it is. Yeah, is that what you say? It's the same kind of helpful psychological issues for survivors. So it's not unusual for people to really struggle with. There are changes after surgery, changes after treatment, so that could be breast reconstruction or not having reconstruction. Having that loss of the breast, it could be hair loss. It could be weight gain. These are all really common body image issues for people after surgery, and then your sexual health care really changes. Well, so some of the medications that patients might take after their breast cancer treatment to help reduce their risk of recurrence and costs of sexual side effects. So it oftentimes, there's some work to do, there are some ways to deal with those side effects. How do you recommend after going through breast cancer treatments and surviving, how to go back to romance? Whether you already had someone that you were with or new to the dating scene. Yeah. What do you recommend for people? Like little baby steps. What to do? Well, I always want to remind people that especially for women the most important sexual organ is the brain. So a lot of it is about communication and talking about it, and also, having a romantic time together so it doesn't have to all be about intercourse. That could be just physical contact, enjoying each other, spending time together. And when you're just finished in breast cancer treatment, a lot